Good afternoon, Your Highnesses, Excellencies, dignitaries and members of the ABLF network and all of our wonderful guests here today. I'm Resham Katecha, a strategy and policy specialist based in London, and I'm absolutely delighted to be here with you at the ABLF City. I have a fantastic guest to introduce to you just now. Miss Alisha Moopen is the Deputy Managing Director of Aster DM Healthcare, one of the largest integrated healthcare conglomerates in the world, with 26 hospitals and employing almost 20,000 people. Alisha herself has had such an illustrious career and won so many awards that I unfortunately can't run through all of them with you, otherwise we wouldn't have time for the actual session. But some of these awards include being elected by the World Economic Forum as a young global leader, being named one of Business Today's most powerful women, and winning the ABLF Rising Star Award. So Alisha, please tell us, as countries grapple with the second and third wave of the pandemic, how have you and Aster DM Healthcare stepped up to meet the many challenges that we've faced?
Hi, Resham. First of all, thank you so much, Your Highnesses, Excellencies, dignitaries, and my dear friends. It's a pleasure to be here on this forum today. And I think Happy New Year to everyone as well. I think we've started the year on some very positive news, especially with the vaccinations and the rollouts that we're seeing across the globe. I think when we look back at 2020, it comes with a whole lot of mixed emotions, at least for us in healthcare. It's definitely been challenging for all industries, and especially for us in healthcare, it has been a massive stress on the system. We are currently, as you mentioned, Resham, in 8 countries. So when we look at the challenges that we've seen in the last 1 year, the present statistics is there have been 90 million people diagnosed with COVID. If you think about recoveries, you've had almost 50 million of these that have recovered. When we look at UAE, there are around 230,000 cases that has been infected, but you've only had roughly around 700 deaths. When you look at India, 10 million cases, just 150,000 deaths. So we have seen very different recoveries in different countries that we operate. But I think the most significant sign, which is really great for us to see, is that it really does not depend upon the resources that a country has or doesn't have. Because when you look at America, you see them grappling very different from what a UAE is or what an India is. For us, I think the 3 main challenges that we faced was mainly around the healthcare workers and the physical and the mental exhaustions that people have gone to. I think it's been pretty much a constant for the last 9 months, and what we're seeing is that continuing. And again, it's the same healthcare workers that are required for the wave 2, wave 3, and we've got to manage that, as well as manage the regular healthcare delivery, which is required for people to access care. And now you've got the third path as well, which is on the vaccinations. So that's one key challenge, which we as a whole team and as nations, we have to kind of figure out the best way to optimize and effectively figure out. I think on the vaccination, I think one of the key things we have also been looking at is on the mental health challenges. And this is not just in healthcare, right? I think all of us have gone through sustained period of stress. Again, how does this affect us in terms of survival? We have to figure out ways as nations, as governments, as corporations, as communities, that how has this impacted all of us? How is it that we want to make sure that people think not about just the physical diseases, but whether it's loneliness, whether it is stress, how is this impacting us, and what is the best way for us to kind of manage this so that it doesn't have any long-lasting repercussions for our communities as well. Having said that, even though there have been plenty of challenges and we are unfolding and seeing the world come together, become even more collaborative as a community, and that's seen largely with these vaccines that have been fast-tracked and accelerated, and you've never seen in the history of mankind a vaccine coming out in less than 12 months. So there's definitely a big silver lining that we're seeing. One of them is the vaccination rollout, where we're seeing almost 4 to 7 billion doses, which are likely to get administered in 2021. Also, in terms of healthcare, there's been a complete new era of healthcare that's dawned right now. when you talk about telemedicine. For us at Aster DM Healthcare, we've had a big shift into virtual care. What we realized is that we could not meet people anymore in the hospitals or the clinics. We had to meet them where they are, and people were back in their homes. So how is it that we can give access to quality care in the homes of the people? So we're very excited that this part of healthcare has gotten fast-tracked, where we are seeing now large number of online consultations, where we are seeing that healthcare systems which were overburdened and very heavy in infrastructure, there are new models of care that's evolving, that's making us maybe lighter, more affordable, more accessible. So that's a very interesting era of healthcare which has unfolded because of COVID as well.
And I want to pick up on that because you've talked about how differences in countries have not necessarily been related to resources, and one of those will be access to technology. So given this drive and this openness to technology in healthcare, of course, we do need people to be able to access that technology if they're to leverage and benefit from it. So what should be done to improve access and inclusivity to digital health services?
So if you look at the world right now, there are around 17 billion devices in the world. And you've got around 5 billion people with mobile phones, and as in actually a SIM card on it as well. The biggest, I guess, enabler for healthcare access is going to be just having access to that 4G and 5G networks. So how is it that we can ensure that people are able to connect virtually with healthcare providers? I think as operating in systems like India, even when we think about it, what we've been exploring are how is it that we can have maybe experience centers or contact centers where we can participate or partner with telco companies, which will actually enable people from an entire radius to come to these contact centers and experience centers and connect without any disruptions to the connection to their healthcare network. I think we'll need to figure out that not everyone's going to have access to this 4G, 5G. So how is it we can give centers like this where hundreds and thousands of people can come in? When we talk about inclusivity, I think another things which we need to consider is languages. Can we have apps in different languages? Because not everybody is speaking an English or a Hindi. So how is it that we can have multiple languages for the different countries in their the vernacular languages that are available, whether we're talking about Africa, which will enable, again, people to access care better. Also, we have to be mindful that not everyone is literate, so not everybody can read and write. So can we have audio services as well, which will enable us to help them have access to that care? So I think these are the multiple kind of levels of services that needs to be rendered that will really help in terms of scaling up the universal health coverage. We always believe that health is the first and foremost birthright. So how is it that we can make our 7 billion people have access to that quality care?
And you talked a little bit about the different healthcare needs in terms of mental health. There's also the talk about long COVID and the longer lasting implications, the focus that COVID has brought on comorbidities like diabetes and obesity and issues like that. How do you see healthcare needs evolving in Asia, especially in relation to the impacts of COVID? And how do you see that impacting globally as well?
So I think there has been a big shift from in the past, when you look infectious diseases to the non-communicable diseases, like you mentioned, the lifestyle diseases like the obesity, the diabetes, and things like that. For things like that, what we will see is a whole lot of data that's coming through as we go digital, as we go online, capturing these data, understanding the trends, understanding how that's impacting each one of us, and then figuring out how do you change behaviors accordingly, incentivize providers, payers, but most importantly, at the end of the day, I truly believe health is very personal. The fundamental change has to come from within. If we don't change our behaviors, we will not be able to get to a better position in health. So all the data can do is act as enablers, act as mirrors, act as giving us insights. But at the end of the day, when it comes to a lot of those diseases that you mentioned, Resham, the onus is really upon us. We cannot be sort of not moving, not eating whatever we want, sort of pretending like we're getting younger day by day, and then be surprised when things start breaking down. I think the biggest issue we have is people do not have any indication or any understanding of their own self when it comes to health. It's very funny when you look at organizations, and if you're an employee, and all of us are employed somewhere or working somewhere, we know how we're doing at work. There is an annual appraisal. You go and you know you've done well, you've exceeded expectations, or you have areas of improvement. When you're in school, you're taught how do you get at the end of the year a good grade? How is it that you can improve? Where do you stand in the class? But actually, we don't have any such insights that come every year or every day for us on what's my health like, depending on my gender, depending on my age, depending on my social determinants, depending on my behaviors, depending on my culture. What is it that my health score looks like? So I think it becomes really important for us to say technology is going to explode and help us in so way understand how these all come together and culminate, and where we stand as far as health is, and how each decision of ours makes a difference in terms of how our health will progress. But at the end of the day, it's again us that has to make those actions speak towards moving in a particular better wellness orientation as well.
And I love that you talked about health and our responsibility for that. And I believe you've said in the past that your philosophy is that healthiness is happiness. So how can we encourage other people to take on that philosophy? And can you explain a little bit more about what that actually means to you?
So I think it's, when you look back at the last 1 year, if anything, it's just taught us that we as human beings, we are such social beings as well, right? We're so interconnected. We want to be with people. And the most important thing is, how is it that we can take care of our health? There is no way we can be happy unless we have good quality health. So for me, it starts with the self. It starts with us taking care of ourselves. Our body is our sort of home, that you can't move out and say, I'm going to go live somewhere else. So how is it you can take care of this real estate? This is the most expensive real estate for ourselves. So how is it that we can look after it? It doesn't matter how well we furnish our homes or what a great car we drive, but how is it that we can take simple steps to look into ourselves, see how we can take care of ourselves? And that's not physical only, right? How is it that we can take care of our emotional health? How can we take care of our mental health? How can we make sure our physical health is, what you eat, how you walk, all of those things, how do you composite that together to create that healthy human being? Healthy human beings leads to healthy societies, productive people, and happy communities. So I love that in Dubai here, we've got this Ministry of Happiness, and how is it that we can actually make sure we make this city the happiest place in the world? And it is so interconnected. You cannot meet a single person who is diseased or ill who will tell you that they're happy. You cannot be. It's mutually exclusive. So let's focus on our health, because that is the roadmap and the journey to happiness.
I do think the Ministry of Happiness is absolutely fantastic. We need more countries to take that on board. And speaking about government policies, what policies do you think are needed by governments globally now in order to really ensure we equip healthcare workers to support people in their healthcare journey? What would you like to be seen done by governments?
So I think a couple of things, Resham. Some of the, like what we saw with COVID, is that most governments fast-tracked a lot of policies when it came to telehealth policies and laws. When it comes to virtual care, what are the data sets? How is privacy managed? All of these were fast-tracked. Even for us as having a range of pharmacies, making sure that people have access to medicine prescriptions. Can prescriptions be done online? Can we have these delivered at home? There are innovative solutions out there, such as drone delivery of medicines. So you do need a lot of public policy interventions to make these come alive. I think we are sitting in a space where there is a lot of investments being made, getting focused into healthcare. There is so many digital tech companies which are out there. So how is it that even the government can come together to have these come alive, right? I think another important thing is just from a medical education perspective, this is an industry which is extremely dynamic, which is growing rapidly and changing rapidly. So important that even digital literacy is a key pillar for continued medical education. So if somebody's got to do 30 hours or 40 hours, I think it's important that governments also say maybe 5 hours or 10 hours of these has to be in digital literacy, because you do need the entire healthcare system to go online to be able to really kind of let this whole healthcare transformation move forward and get propelled further fast.
Absolutely. And whilst we're doing all this work with our healthcare force, how do you think, or how are you at Aster tackling healthcare force burnout? The last 10, 11 months has obviously been incredibly strenuous physically and mentally on our healthcare workers, and it's not looking like that's going to ease off anytime soon with this epic vaccination rollout. So what can we do? Do you think enough is being done, and what more would you have governments and organisations do?
So this is a very key area of concern for all of us within healthcare. And I think one of the most important things that we are all trying to work with is upskilling the existing group of healthcare workers, right? How is it that we can actually prepare them upskilling at different levels? So there are a lot of times that nurses are doing things which maybe are admin related, they need not to be wasting their time with. Can we get other people? Can we get the system? Can we get technology to support in these things so that they can focus on the core nursing aspect? Same thing with doctors as well. So I think, again, technology will help in kind of segregating some of these roles and making sure that we use the healthcare precious scarce resources very effectively as possible. And at the end of the day, you have to realize that this is, people bring their heart and soul into healthcare. Making sure that they are in the right frame of mind is extremely important. So for us as an organization, we do try to develop as much support groups as possible, because we need to have those constant dialogues and conversations with our people. And people need to be mindful that as they're feeling the burnout, they take that time out. We have to do that, because otherwise that will create even bigger issues in the health system. You cannot have someone who's not physically, mentally there taking care of others. So you've got to first take care of yourself. So for us, our utmost and first priority is always making sure our people are okay. And we only believe that as our workers are okay, we can make sure that that same care and compassion gets passed on to the population that we're serving.
Absolutely. I cannot imagine how difficult it must be being involved in healthcare at this moment in time. So those workers are doing incredible jobs. And speaking about the impact of the pandemic, of course, governments have had to drop almost everything else and really focus on healthcare. Do you think that the pandemic is going to mean that longer term governments reprioritize their budgets to allocate more resources to healthcare services? And do you see that playing out differently between developed and developing countries?
So I think when we started last year, before the pandemic as well, everybody speaks about the scarcity of healthcare, whether it's beds, whether it is healthcare workers, right? So there is going to be a relook at the healthcare spending and the budget that's allocated for healthcare across the globe. I think it will, what it has kind of taught us is that there is every possibility things like these could happen. We live in a very interconnected world, and it comes with a lot of benefits, but at the same time, spreading diseases like this is also just as fast because of how connected we are as a globe, right? So there has to be a relook at the budgets which come for healthcare. So even if you look at ourselves as a health system, we've seen decrease in physical capacity, because suddenly you've got social distancing norms. So where maybe I used to see 500 patients in a hospital in a day, maybe at this point in time I can only see 300. When you look at the cost of healthcare, that's increased as well, because you've got the additional cost of PPE, sanitation, so many things that's come on board. So I think as healthcare institutions, nations, countries, there will be a relook at the budget, and it's really about prioritizing healthcare as the national agenda, right?
Of course. And you've spoken in the past about your passion for women's empowerment and the importance of mental health. Studies from around the world have shown that COVID has impacted women significantly, whether it comes to financially, their jobs, or mental health issues. How can we tackle that, and what would you like to see governments and organisations doing to support the women in this crisis?
Yeah, so I think it's twofold, right? So when you look at the pandemic itself, it's affected more men than women globally. But then when you look at this new way of working, which for most industries where there is the work from home that's come up as an option where children are studying at home, it's sort of put an unusual or a sort of an additional amount of burden back on the women, where the support mechanisms that they'd set up, whether it was schools, whether it was nurseries, whether it was going to work, has all kind of evaporated pretty much overnight. So that has, again, sort of put a lot of that burden back on women. So I think at this point in time, naturally, everyone is focusing on how to make sure that the pandemic is in control, how to make sure people are safe. But equally, Resham, you're absolutely right. We need to make sure that there is enough focus on what can we do to create the support system back for women, because we are seeing increasing departure of women from the workforce because they just cannot handle all three roles at the same time. So we will have to figure out what is the best way to give that support back into the system so that people are able to manage, women are able to manage these multiple roles that they have in their lives.
Brilliant, thank you. And I wanted to pick up on one of your earlier points where you talked about digital adoption. And of course, we know we've started to see that come into play in healthcare. According to you and your global experiences, which tech sectors do you think will emerge as the leaders in this digital transformation? Other than drone deliveries, what exciting developments do you see coming our way?
I think there's so many very, very interesting things that are actually coming up right now, right? I think even just when we look at the beginning of the pandemic, the triaging, the testing, the reopening of sectors, all of these have been done with, with a lot of help from technology. Even in terms of making sure who comes into the hospital, the chatbots that we had in place, the kind of filtering that happens like that, which really kind of makes sure there's no congestion in the healthcare system, because a lot of people being fearful were trying to run to the healthcare system, which kind of was counterintuitive. So even using small tools to enable people to understand, no, do I need to go to the hospital? Do I need to go to the clinic? That becomes important. We spoke about even, I think, one area which is most exciting that we see is on medical education. With augmented reality and with VR, learning is going to change drastically within healthcare. Learning and upskilling of doctors, upskilling of the nurses, all of these can happen with the help of technology. So how is it that you can get healthcare assistants, get nurses, get doctors, get them upskilled using technology, using VR, augmented reality? I think that's going to be something which will really help us address the whole shortage of healthcare professionals. Very interesting things happening in terms of robotic surgeries. So how is it that you can actually have a surgeon in India do a surgery out in Africa? So all of these ones mean that the physical separation means nothing anymore, right? So you could have access to the best quality care and the best expertise from around the world, no matter where you're sitting. So I think that's some really, really interesting stuff that we're seeing. Again, on mental health, there are a lot of, because there's a severe shortage when you talk about psychologists and psychiatrists, which are there. But again, here is where you've got AI playing a big role in terms of trying to understand how our responses allows machines to understand where we stand as far as our mental health is concerned, which again then helps you kind of direct the ones that are more prone to depressions and bipolar disorder and et cetera, to the relevant healthcare professional. Or dementia. when you're talking about early diagnosis, Alzheimer's, dementia, again, where you have technology playing a very key role in that. When you're talking about rehabilitation and motor skills, again, you've got AR playing a very key role in just sort of simulating environments which make you feel like, okay, if I'm about to fall down, how do you quickly kind of rebalance yourself? So you've got technology, honestly, making a whole quantum leap that diseases which earlier you could not rewind and recover from, you're seeing massive progress coming through. And then you've got the holy grail that a lot of people talk about, wellness and anti-aging, and how is it that I can go back to being, 18, 20, whatever it is, right? So you see a lot of investments also going in terms of the anti-aging wellness recovery as well.
Of course, and I think what you say is so fascinating on the inequalities of healthcare outcomes, in that you could learn anywhere, but actually that plays a massive role in social mobility as well, that you could have people who might not normally be able to afford the costs of that education. We might be able to see a whole new stream of people entering healthcare because they can gain education at, a fraction of the cost that it might normally be. So that is super interesting. Now, I wanted to ask you, back on the pandemic, we've seen a significant impact on senior citizens being particularly vulnerable. Do you see that changing or impacting geriatric care and the way we anticipate and provide healthcare to that age group?
Yeah, I think this is the segment of the population that we have to be most concerned about, and because they are the most vulnerable. So some of the technologies which are coming live, even in terms of assisted care, how is it that you can actually have robotic care just to help with the movements? Because at the end of the day, you've got to restrict having a lot of close contact and a lot of the interactions, right? So there's one part of that which will really enable geriatric care. But having said that, I think there's a big emotional element that needs to be taken care for the senior citizens as well. For people, it is a lot about having the touch and feel, having people, meeting people. So I think we will need to, as an industry, as communities, kind of figure out what is the best and safest way to keep them safe, as well as make sure that they have the emotional attachment and the comfort to sort of manage care better.
Of course, and unfortunately, we've heard people say that with pandemics, it's not a question of if, it's a question of when, that we will see more pandemics, especially the more interconnected we become. How can we as a world prepare for that? And what would your advice be on what governments and organizations should be doing to anticipate a future pandemic?
So I think we have seen, as I mentioned right at the beginning, different countries responding very differently. The level of collaboration that you see between governments, between private and public, the relationship between the state and its people, it plays a key role in sort of how a nation manages the pandemic as well. And we've seen stellar examples of that, and some which are not so stellar, right? At the end of the day, when it comes to health, I go back to what I said before, a lot of it is personal. We have to take a lot of personal care. The hashtag which was here, we're all responsible. At the end of the day, when even it comes to COVID, just making sure we're wearing a mask, we're sanitizing, we're staying apart. These are simple measures which will avoid any of the spread in these massive numbers. So it really requires all of us to take the action and not sort of leaving it for a government or for anyone else, because it is each of us being equally responsible for our own health as well as the health of everyone around us.
Well, I think that's a brilliant note to end on. Thank you so much, Alisha, for your time and for your really careful thoughts. It's such a privilege to have you here. Thank you for all the work you're doing. I know it must be such a stressful time taking care of your healthcare workers who are in turn taking care of the rest of us. So thank you very much. To the audience, thank you so much for joining us today. There are lots of other sessions, so please do check them out. And if you missed the start of this or any other session, you can watch them all on playback as soon as each session finishes. So thank you for joining us for today. And remember that we are back every month featuring global leaders in powerful conversations.